All right, good day, my friends. I hope everybody's doing fantastic today. We had gotten a bunch of questions about this over these last couple of weeks, so I thought we would do another little kind of in between episode where we answer some questions about bones. So we are going to be diving into everything from the treatment, prevention, diagnosis of osteoporosis, and how do we build strong bones and actually take that information and create kind of a routine around that. And so when we look at what causes osteoporosis, we have to kind of go through and answer a few things. So what we're going to do on today's episode is basically go through everything around osteoporosis. How does it happen? Why does it happen? What does that mean for us? What can we do in our lives to improve the health and the strength of our bones? What should we be eating? And we'll even kind of make a little routine at the end that's a nice little kind of sample of how you can follow some of this stuff. Before we dive into that, I want to say thank you to everyone who is sharing the show, getting it out there. We're constantly getting feedback from people that are hearing the show and getting a lot of value. So when you share this, just know that you're changing someone's life. You are giving them tools and empowering them to make health decisions that they may not have, or they may just need a little extra push to do it. So I appreciate every single one of you. It means the world to me whenever you leave reviews and share the favorite clips and the ideas that come out from these things. It really does mean everything to me whenever we're doing this. So without further ado, let's take a step into the bone zone. So osteoporosis is a skeletal disorder that is basically occurring when our bone mass is decreasing. So that means that the bone tissue is breaking down faster or more than we can build bone. So the mechanisms, there's two major things that we look at with that. There's your osteoclast activity and your osteoblast activity. So osteoclasts are the cells that are responsible for breaking down and reabsorbing bone tissue. So in osteoporosis, osteoclast activity may increase, leading to more bone resorption and bone mass loss, or it may stay the same while osteoblast activity decreases, which leads to a slower kind of osteoporosis or bone mass loss. But this can happen due to hormonal changes. A decreased level of estrogen in women, testosterone in men can promote osteoclast activity. So it's breaking down more bone, which is why some of the therapies are targeted towards that. Inflammation is another big one that we see increase in osteoclast activity. So that's why some of these things become really important when we're looking at preventing osteoporosis, osteopenia, is how do we keep these things functioning well, keep our hormone production really well, and keep inflammation and other factors very low that would increase osteoclast activity. The bone formation part of this is where osteoblasts are the cells responsible for building new bone tissue. And in osteoporosis, a lot of times we see the opposite response in osteoblasts. So they start to decrease. They're not building enough bone. And that can, same thing, occur because we have some hormonal changes that are taking place. We have less growth hormone or IGF-1 insulin-like growth factor, which kind of acts as a growth hormone. Both of those things promote osteoblast activity. So if we don't have the hormonal function to improve osteoblast activity, we're not building bone fast enough while we're still breaking it down, and so our bone density decreases. We also see nutritional deficiencies in these areas. So like low calcium level, vitamin D is another one that can really impair osteoblast function and contribute to bone loss. So when you look at those, there's quite a few things that get wrapped up into that. So you got, of course, we have age-related factors that lead to osteoporosis or osteopenia. It is highly associated with older age. And so that's something that we look at. These things become more and more important as we get older and older. When we look at nutritional deficiencies such as calcium, vitamin D, we know that those things will lead to a higher risk for osteoporosis or osteopenia. So it's something that we definitely want to be looking at. And then also inflammation and genetic history. If you have had a history of high systemic inflammation, these things become very important for you to look at. You really do want to pay attention to your exercises, activities, testing that are related to bone health, because it becomes very, very important. The mechanisms and kind of risk factors around promoting, bone formation and slowing bone resorption is something that really can make a huge change for people in terms of how much strength, activity, quality of life that they can build based on just changing some activity level, just changing some things that they're doing in their life, and how much does that actually change the mechanisms and risk factors associated with osteoporosis. So when we dive into preventing osteoporosis, well, let's do this. Before we do that, what does the diagnosis of osteoporosis look like? So a lot of times we'll do this with bone density tests, something like a DEXA scan, dual energy x-ray, really does a good job of telling us the bone density throughout the body. And a lot of these will tell us specific spots. A lot of times they'll use the hip as kind of the major diagnostic area, but the more advanced ones are going to give us multiple sites throughout the body. Of course, being over 65 for women is a big factor, and we really want to start paying attention to all of the therapeutics that we need to do once we hit that age. So it really does become more important. I tell my patients, a lot of these things, when you start looking at it improve dramatically if you're doing these activities on a 3 to 5 year span, because you're building every time you go. Every time you do it, the longer and more consistent you're doing these types of activities to prevent and improve bone health and build strong bones, the best time to start that is likely when we're in our 50s. That's when we have the greatest chance to improve this stuff. Now, the second best time, if we're already past that, is today, starting to do these things as soon as you can. So, if we look at somebody and that knows they have a family history of it, I tell people to start right away. Start as soon as you can. If you know that, you had a great-grandmother, great-grandfather who had compression fractures, had falls and fractures, and you have a genetic predisposition to osteoporosis or osteopenia, start doing these things as fast as you can. So when we go to what can actually help us build strong bones, what are the things that do that? The biggest things that we're going to go through today are going to be looking at some of the activities that we can do and bring into our life, such as supplementation, diet, some of the specific types of exercise that'll really improve the health of the body and improve the health of the bones and the strength of the bones. And we'll go into some supplementation as well, and what do the proper supplements look like for some of that stuff. So let's start specifically with some of the information around exercise, because if you're not exercising, you are missing the biggest input that you can in terms of improving bone health and bone strength. So the main things that we want to do with exercise is start improving and changing our resistance exercises. And this is my pushback against people who are just doing cardio, or they're just doing mobility types of training like yoga, Pilates, is that we need to add more of a resistance focus into our exercise routine. And this is like weight bearing, pushing weights, pushing resistance against our body. So I'm doing squats with weights. I am doing leg press with weights. I'm doing a bench press, I'm doing an overhead press, I'm trying to get loads through the long bones in my body, because what will happen with that is I will actually increase the osteoblast activity and the hormone activity in my body to start building and strengthen those bones, because the signals from doing these resistance types of exercises tells my body we are going to be dealing with loads, and I don't want to take the risk that something happens in the future. So let's start to increase the strength of the bones, of the tissues. And the way that we're going to do that is start releasing these growth hormone factors. We're going to start going through the different cellular mechanisms to increase osteoblast activity. So you're building more bone, and you'll actually decrease osteoclast activity. So add in strength training. You have to do it. We've got to be pushing against weights and start progressing with that in a safe way under guidance. You want to be doing upwards of 70 or 80% of what you think you could do in low repetitions. So this might be, if you remember the last episode on how do we set up a strength training program, there should be times throughout the year where you're doing, 70, 80% of what you could, 70, 80% of a 1 rep max for 3 to 5 repetitions for 3 to 5 sets. So that's a very easy way of going about this. We're not doing a ton of repetitions, and we're doing, let's say we do 3 repetitions. Well, we're doing 5 sets. So we're doing 15 total repetitions, but it's at a higher weight, above 80% of what you think you could do. And for everyone, that's going to start anywhere. That's going to start wherever you think you are right now. And as you get there and you get to, a few weeks in and you notice, well, actually I had more in the tank. Okay, well now I need to go up in my weight, because when I get to the last set, that third, fourth, or fifth set, I should be getting close to where I'm really, really struggling. I didn't have a lot left in the tank. Again, we're doing this in a safe manner. We're doing this with help, but we're making sure that we're pushing the body to improve the strength of the bones and the tissues. One thing that we talk to our patients a lot about adding in to this routine is something called blood flow modification therapy. We use a system called Katsu. You can go back and listen to our episode with Stephen Muñatones on the benefits of Katsu and what it does and how it actually increases the strength of the bones and the release of growth hormone in the same activities. So when we do blood flow modification therapy, we're putting these smart bands around our arms, and those turn on and they add a little bit of pressure along the vessels in there. So they slow the blood flow to all the tissues, the bones, the muscles, everything. So when it restricts that blood flow, it actually makes my body think that it is working harder, because I run out of oxygen faster. I am working these muscles. Normally they would be getting enough oxygen. If I worked really hard without the bands on, there's a point at which I can go to failure where I'm working the muscle too hard and the tissues too hard, and I can't get enough energy produced out of them. Well, we can skip that part and do it with less load if we add this blood flow modification band on there. So what happens is when my body thinks that we've gotten to that point, even though I'm doing it under a lower load, I can actually skip to the release of growth hormone, which stimulates, growth and repair. So that happens at about 300% more when we have the bands on, if we equalize the load in the exercise. So I can get 300% more effective hormone production to improve the strength of my bones, even at a lower intensity. So I'm lowering my risk for injury or a lower weight, either way, and still get this massive, growth hormone release, so that I'm really improving the health of my bones and the strength of my bones. This is something that we should be working into our lives. If you are one of those people that has the risk factors of osteoporosis or osteopenia, strength training with blood flow modification or Katsu should be a cornerstone to your week, your training routine. when we look at some of the studies around the effectiveness of blood flow modification in improving it, there was a 2017 study in the Journal of Osteoporosis International that did 12 weeks of blood flow modification with resistance exercises like we're talking about. And what they found was that it resulted in significant improvements in bone density and bone turnover markers, even in postmenopausal women with osteopenia. So really, really effective at changing the risk factors in the bone health and strengthening the bones in women who already had osteopenia. So it's a really, really good indication of what we can accomplish if you work this into your life. There was another study on the Journal of Clinical Interventions in Aging in 2019 that found that blood flow modification therapy improved bone density and, of course, muscle strength in elderly women with low bone mass. So they already had osteoporosis, and we were still able to see an improvement in bone density by adding in the resistance training with blood flow modification therapy. So very, very helpful. This is what we've seen in the clinic whenever we work this in with our patients, especially if we start wrapping it into some of these other therapies. So the other one that I'm going to talk about now is something called PEMF, pulse electromagnetic field therapy. And this is a therapy that improves cell signaling to improve blood flow. So a lot of times we'll call this a vascular therapy because there's a lot of research on it, opening up and delivering blood and oxygen to all the tissues. Fantastic at doing that. Helps it heal, helps wounds heal much faster, helps tissue heal a lot quicker. And if we have areas that are hypoxic, that don't get good oxygen, and you start doing PEMF, it is incredible what it can do to help improve that. What can it do for bone? Well, same thing. If we're going to support the cell activity in our bones to strengthen them, if we're doing something to tell my body to increase that, that's the caveat with this, is I think PEMF can be very valuable in osteoporosis and bone health, osteopenia, improving the density of the bone, if I have that underlying activity part already checked. So when we do that, my body's trying to go in and strengthen the bone. All I'm doing with PEMF is helping all of those factors out. So I'm going in and improving blood flow, improving cell function, so that the stimulus that I've already done from my exercise routine and some of the other therapies is just enhanced. And so they have done some studies on this. They found that adding in PEMF therapy can be beneficial for bone health overall. It improved blood flow and the cellular activity inside the bones. They found that bone density and the reduced risk of stress fractures in postmenopausal women with osteoporosis. So we actually saw a decrease in fracture rate whenever they added in the PEMF therapy. So that's really helpful because that's part of what we're trying to do with all this. If you end up with a fracture, and I'm gonna forget the exact metrics on it, but someone who had a hip fracture over the age of either 70 or 75, the expected survival is less than 2 years. So if we can prevent those fractures, again, don't quote me on those numbers, but it's something like that. If we can prevent a fracture once we get above the age of 65, that really can be life and death. We're not talking about doing these exercises for no reason. This can change someone's life dramatically for how long can they be enjoying their family, traveling, doing the things they want, being with grandkids, great-grandkids, great-great-grandkids. This stuff can really dramatically change the quality of life and the span of life if we start doing these at the right time. So it's not a small thing. PEMF can do that. It reduces inflammation and reduces oxidative stress, which contributes to bone loss. Of course, it contributes to other health factors as well, but it can be a really good adjunct to a bone health program. It's worth noting that a lot of our patients will come in and do PEMF and they'll combine it with cryotherapy. While I wouldn't put cryotherapy in something that I'm saying is a big hitter in the osteoporosis world or the bone health world, I think improving hormone function, improving energy and overall health while we reduce inflammation in the body is very, very helpful in these situations. So if you have the means and you're like, look, I know I've had family history and risk factors that have added up, it's definitely something that I think moves the needle and is worth the time and expense to add into a full-scale bone health program. So very, very helpful to kind of add in PEMF and layer that in with something like cryotherapy, because it does such a great job at reducing inflammation. And we know chronic inflammation definitely increases those osteoclast cellular activity and can help, speed bone loss, if you will, and bone weakening. So it can definitely be a big part of the program, if you will.